California counties have launched a statewide Healthy Stores for a Healthy Community campaign. It's an amazing statewide collaboration between tobacco use prevention, nutrition, and alcohol prevention partners. Recently, over 10,000 stores were surveyed to assess availability of healthy and unhealthy options in local retail stores. The following public service announcement from the California Department of Public Health Tobacco Control Program shows what youth in many communities face on their way to school.
This is Antonio. He loves building things and solving puzzles. Antonio doesn't realize it, but there are companies who are after him. Antonio walks to middle school every day. Along the way, he passes by stores that have one thing in common. They all sell cigarettes and a lot of other tobacco products. In fact, in California, there's a store that sells tobacco for every 254 kids. So why is that bad? Because tobacco companies place eye-catching ads in these stores, which influence our kids to smoke. And many of these stores are within 2 blocks of schools. You may be surprised that research shows tobacco ads are more powerful than peer pressure. So you may not have seen tobacco ads lately, but Antonio sees them every day in his neighborhood and is nearly twice as likely to start smoking. Stand up for our kids and protect them from a lifetime of addiction. Learn more about what you can do at tobaccofreeca.com.
The following interview shows the perspective of a retailer who owns 2 local grocery stores called United Markets. We interviewed Bill Daniels, the owner, to find out why he chose to stop selling tobacco and refuses to sell tobacco products or electronic smoking devices or kid-friendly Alka-Pops in his stores.
We're United Markets, where we've been, we started in San Francisco 50 years, back in the early days. We came across the bridge in 1955. We've been here in Marin County for 60 years now. We're going to have our 60th anniversary this year. So we're over 110 years old. Now we have 150 employees. We have 2 markets, 2 supermarkets. We were the first supermarket in Marin County. Back in 1955, and we have markets, one market in Santa Fe, one market in San Anselmo. I think that the e-cigarette situation is appalling. Cigarettes are not good, chewing tobacco is not good, Alka-Pops are not good. I'm dead against all of the above. Alka-Pop, it's a beverage that has a tremendous impact. I think it's about 3 beers per bottle, and it tries to appeal to the young female.
Zima. What is that? A beer?
Since the 1990s, when youth-enticing Alka-Pops first hit the U.S. market, these industry-named flavored malt beverages, or FMBs, have morphed into far more dangerous alcoholic drinks. Alcohol Justice and the San Rafael Alcohol and Drug Coalition have released a new report called Alka-Pops, Sweet, Cheap, and Dangerous to Youth. It traces the transformation of Alka-Pops from their introduction in the 1990s as 8 to 12 ounce drinks with 5 to 8% alcohol to today's potentially lethal binge in a can, 25 ounce, 14% alcohol, supersized Alka-Pops. The new report describes how the alcohol industry makes Alka-Pops seductively attractive to youth, resulting in very harmful consumption. It also suggests how communities can respond effectively to reduce the dangers and harms the products cause. In the past, we were very concerned about Alka-Pops. Now we are deeply alarmed. Alka-Pops continue to be very popular among youth due to the sweet taste, extensive variety of flavors, high alcohol content, cheap price, and widespread availability. In addition to findings in the report, like the disturbing fact that Alka-Pops cause disproportionate harm to youth, we offer recommendations as valuable tools for policymakers to help reduce youth consumption and alcohol-related harm. Our new report is actually a call to action, said Bruce Livingston, Executive Director of Alcohol Justice. The clearly demonstrated public health consequences of these products on young people must be addressed, he added. Please visit alcoholjustice.org to download an electronic copy of Alcopops, sweet, cheap, and dangerous to youth.
It's where I got very involved in it, and I discontinued Alcopops as soon as I found out about it. We had it on our shelf for about 1 week, and then I discovered what it was all about, and it was eliminated. I've been fighting this tobacco issues since 2002. I kicked them out of our store, kicked cigarettes out of our store in 2002. I believe I was the first supermarket to do so. The reason I did is because I had an employee who died of cancer, and it hit me very hard, and at that particular point, I just decided right then and there that that was the end of cigarettes.
As a result of going tobacco-free, United Markets prospered. They received letters from grateful customers for several months and a very positive editorial in the local newspaper, along with letters to the editor. United Markets was even honored in Congress by a commendation in the Congressional Record.
We received many pieces of correspondence saluting us for our decision on discontinuing cigarettes in both of our markets.
13 years of not selling cigarettes. How does that feel to you?
Well, it feels wonderful because I think a lot of people have followed my lead, and I see other stores making that decision, and I think it's the right thing to do. I hope that everybody comes on board and we have a smokeless society. I'm just so into good health and so into trying to keep the community healthy that it's very valuable to me. We are on a mission. We do not want to sell tobacco products, e-cigarettes, chewing tobacco, anything that is going to harm the child or harm the individual, causing cancer and diabetes and various other diseases.
What about storefront signs? You've seen stores that are just plastered, and we did the statewide survey, and a lot of them, especially the ones near schools, they have unhealthy junk food, sugar, soda pop, alcohol and tobacco ads on their storefront signs. You know, the windows are almost covered. Do you have a philosophy about your...
My philosophy on anything on storefront or anything publishing or promoting cigarettes is completely forbidden. It's just one of my policies that we will not do it. Windows out in front of the store, signage will not be in our stores. When e-cigarettes first came out, I had a beverage supplier, actually a wine and liquor supplier, approach me, sales rep, and told me that I was crazy if I didn't jump on the bandwagon. And he said people are promoting and finding room in their warehouse. It's a profit center. It just absolutely will make you all sorts of money. And at that particular moment, I said, I'm not interested in profit, I'm interested in health. I want nothing to do with anything that's going to harm somebody.
How did he react?
Well, he was shocked. He thought that he'd never heard this before. He thought that I was the only one that was making this stand. And I said, well, that's my decision, and I just don't want any part of it. He said many stores are clearing out space in their warehouse to accommodate this new trend. And he said it absolutely is what you should be doing, and I don't know why you wouldn't take advantage of this. And I said, I don't sell cigarettes, I'm not going to sell e-cigarettes. Well, I'm a firm believer in fresh produce, bottled water in the check stands and not the sugar drinks, and the Alcopops, keep that away from the check stands, keep that away from children. I'm a firm believer in having fresh produce out in front of our store to remind everybody about good health. And we just remodeled our San Rafael store, and we enhanced the produce department, so we have major displays of fresh produce, just to keep everybody in mind that health is in produce and not in cigarettes and in sugar. Well, I just would like to finish by saying that I wish that everybody would come on board with us, and then think about your grandchildren, think about your great-grandchildren, and think about the community, think about good health, and think about what you can do to make your community a better place to live. Yeah. I think the grocery store plays a major role in good health, and I think that more store owners should look at that and realize that we are the focal point. They are looking at us to make good decisions about health.
Many chain stores such as Target, Raley's, Bel Air, and Nob Hill Foods, and even CVS pharmacies have decided to stop selling tobacco and electronic smoking devices in their stores because they contribute to addiction, diseases, hospitalizations, and premature death. The following interview with Dr. Aglaya Panos, pharmacy adjunct professor and president of the Marin County Pharmacists Association, shows why pharmacists are joining the tobacco-free pharmacy movement.
The California Pharmacy Association has taken the position not to sell tobacco products in pharmacies. The reason the local, state, and national organizations have taken this position is that the perception is that if a patient comes into a pharmacy and sees these products, they feel that they're safe, and they're not. We're giving them mixed messages. We cannot sell products that cause illness in one aisle and then sell products that treat the illness in the other. It's a conflict of interest. It's not appropriate. So the time has come for this change to happen. Our pharmacy community is opposing the sale of e-cigarettes and vaporizing products in pharmacies. The nicotine is often highly concentrated, greater than it is in tobacco products, making people more addicted or quicker to be addicted to these products, to the nicotine. And also some of the young people are replacing the nicotine with marijuana oil and other drugs, causing even more severe problems. We need to address these issues and not be selling nicotine vaporizing products in our pharmacies. When a person walks into a pharmacy, he thinks he's a customer. He should be thought as a patient, because they are patients, and we are to treat their illness. We are to be concerned about what's best for them, not what's the bottom line financially.
The following public service announcement from the California Department of Public Health's Tobacco Control Program shows how new tobacco products and electronic smoking devices such as candy-flavored vaping pens are the new nicotine delivery toys that appeal to kids.
Whoa! We showed these kids some products purchased at a nearby store and asked them what they thought.
Ooh, this is cool. We all picked up the same thing.
What they didn't know is that each one was a tobacco product.
Oh, I think it's a grape. I see that right there. Oh, look at mine. It smells like gum. Yummy. This one looks super cool. Ooh, this is pretty. Shiny. It smells like strawberry. I'll say these are my favorite. Blueberries. Animal. Got two animals. Animal. Ugh, are these mints? Hey, look at this one.
The tobacco industry spends nearly $1 million an hour marketing its addictive and deadly products.
Pink is one of my favorite colors.
With brightly colored packaging and fruit and candy flavors that kids love, who do you think they're targeting?
Could I have one? How about we each get two? Wait, I found them now. We get to keep any.
We also interviewed a general manager and the owner of two more independent community markets to find out why they stopped selling addictive, unhealthy products.
My name is Al Monero, and I am the general manager of Sonoma Market and Glen Ellen Village Market.
And I'm Dale Downing, Sonoma Market owner and Glen Ellen Village Market owner, along with my partner, Don Shelton.
We're located in Northern California. We have 160 employees at Sonoma location and 40 at the Glen Ellen Village Market location. Total of 200 employees.
51st year.
How many years ago did you stop selling tobacco?
Well, it's been so long, I can't, to be honest with you, I can't remember. It's been at least 10 to 15 years, maybe even longer. We got so many people writing letters in response. We were in the Chronicle, we were in the local paper. People were writing us thank you letters for not selling cigarettes. We haven't missed it, to be honest with you.
So what do you think of this new electronic cigarette trend with the candy-flavored e-juice that people are vaping?
We don't want our kids putting chemicals in their mouth. I mean, that's not for us. We're not going to entertain the idea. We're not going to sell it, and we won't be forced to sell it. Yeah, it's not who we are. Yeah.
And it's the same thing as having a cigarette. Yeah, electronic cigarettes are, might as well be smoking.
It's the same thing as a cigarette. They're just dancing around it to try to get you involved with it.
It's hard to quit smoking.
Yeah.
It is. I know. It took me 8 years of trying. And that was about 40 years ago I quit. And it's hard. It's addicting.
I won't even talk to our sales reps. We were not going to spend time with that. If they want to talk to me about it, I won't even see them. And so since we stopped carrying cigarettes 15 years ago, we're not going to open the door and bring that back in, because it's a cigarette. Any way you look at it, it has chemicals, it's not good for you, and we don't want any part of it at Sonoma Market or Glen Ellen Village Market.
The electronic smoking.
The electronic smoking, yes. Yes, we're not going to entertain the idea, and it's a cigarette, but they're dancing around it and saying that it's candy, and but it's not. It's smoking a cigarette, and we won't carry it.
Like United Markets, Sonoma and Glen Ellen Markets refuse to sell Alka-Pops. As we saw earlier in the Alcohol Justice Center video, these beverages combine the sweet taste of soda and juice with alcohol and sometimes even energy drinks to create a taste that's appealing to youth, according to an American Medical Association report.
Yeah, we don't believe in Alka-Pops. We don't believe in selling this to, and getting this into our into minors. I mean, it's not healthy. Some call it a sleazy alcohol, and it's not what we're about. I mean, we don't want our kids having this stuff, and they're not going to get it from our stores. Our philosophy, I feel, is making a difference. Making a difference in the community, making a difference in the environment. As an independent, what we did is we switched our conventional to organic, so now we have much more organic than conventional, and we get a very positive response to it. It's working very, very well for us.
Notice that there isn't even any junk food signs on your windows.
We don't sell it, so we're not going to advertise it for sure. And, we need to, be a little bit, conscious of what we're selling. So we aren't going to put that kind of signage up.
We'd rather put a sign that helps a nonprofit organization.
Right.
There's so many of them in the valley, and that's what we're about. Helping in the community. We're not going to advertise for e-cigarettes and alcohol pops. We don't believe in it. We're not going to advertise it.
Right. At first, you're going to be a little bit worried about it, and we were a little worried about not selling cigarettes. Are they going to go somewhere else and buy their stuff? Their other products, their bread and their milk and all the rest of it. Didn't happen that way at all. It seemed to actually, people were so responsive to us not selling it and thanking us. I think they went out of their way to come in the store. You're basically doing the community a service by not selling this, and I encourage it. I don't know. It worked for us.
Step out of the box. Step out of the box and see how you can really sell some groceries. We don't want to sell anything that's not good for our community, not good for the environment. Again, that's not what we're about. We have been doing well for the last 5 years, where we've shown an increase in sales over comp sales last year. Every year in 5 years. Yes, we are doing very well.
Seems like ever since Al came.
Thank you.